Hello everyone, in this presentation we will introduce method of electrical muscle stimulation to improve hand-eye coordination training in gaming. Hand-eye coordination refers to the harmonization between visual information and hand movements. In this coordination, the information perceived by the eyes is used to guide the movements of the hands. In many games, hand-eye coordination is important for the player's experience. Players often spend a lot of time when faced with some unfamiliar movements and skills training. Higher hand-eye coordination helps to master those skills quickly. However, lack of hand-eye coordination makes it difficult for people to quickly master an unfamiliar skill. Generally, when people learn those skills, they make mispredictions because they are based on their senses. People need to repeatedly correct those mispredictions and adjust their body control to master a skill, which is an ongoing and repetitive process that will consume a lot of time and energy. Electrical muscle stimulation is a technique that uses tiny electrical currents to stimulate and control the muscle activity. Previous research has shown that EMS has the potential to train motion perception in humans. The mechanisms of hand-eye coordination are closely related to those of motion perception, and both rely primarily on sensory input to control the body. Based on this similarity, this study proposed a method for training hand-eye coordination using EMS. By using EMS, the location of attention during hand activities can be improved and the hand-eye coordination can be enhanced. The approach allows for more effective training of hand-eye coordination skills in a shorter time. The purpose of this study is to train hand-eye coordination in games using an EMS-based system. Hand-eye coordination training using EMS may help players quickly become skilled at locating attention in unfamiliar activity to improve hand-eye coordination. Our goal is to enable players to master hand-eye coordination in unfamiliar sports in a short time, thereby improving their gaming skills and enhancing the gaming experience. The system includes the EMS device, eye tracking, and a custom training game. During the training process, using the EMS can effectively improve the player's attention location in the game, thus increasing the efficiency of hand-eye coordination training. We use this system to test players' attention allocation in games and conduct control experiments in both custom and real games. We first tested participant on attention allocation. 10 participants were tested before and after using the EMS. The results showed a significant improvement in the participants' attention allocation after using the EMS. We then performed hand-eye coordination training in a customized game. 16 participants were divided in two groups with and without EMS. The results showed that the participants who used EMS showed more significant improvement in game scores after using compared to those who did not. To verify that the training approach using EMS is also effective in real games, we experimented with a music game called Osu, a typical game that relies on hand-eye coordination. As before, 16 participants were divided in two groups and trained respectively. The results show that after training, participants who used EMS had a similarly significant higher completion rates in OSU that those who did not use EMS. Finally, we investigated the retained effects of the participants on uh, 1 week after completing the training. The results showed that the participants were able to retain the training effects at the 1 week post-test, regardless of whether EMS was used or not. There was no significant differences in retained effects after the 1 week for the training method using EMS compared to the repetitions without EMS. This study proposed a method for hand-eye coordination training in games using EMS. Through a series of experiments, we demonstrate the potential of using EMS to repeatedly train and improve skills in games. As for future work, we will further validate the feasibility of using EMS to train hand-eye coordination. We will collect data from more participants and validate the effectiveness and generalizability of hand-eye coordination using training using EMS in more games. We will also conduct a longer time of retained effects experiments. Moreover, not limited to quantitative analysis, we will also conduct a qualitative analysis to further validate the effectiveness of hand-eye coordination training using EMS.